afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de ce point de presse. Before we begin, a quick reminder to remain on mute until I invite you to speak or to ask your question. Available for questions from the media, we have disponible pour répondre aux questions des médias, nous accueillons in council chambers, Mayor, le maire, Jim Watson, Steve Kanellakos, City Manager, Directeur Municipal. Joining us via Zoom, we also have Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, Président du Conseil de santé d'Ottawa, Dr. Brent Mallockney, Deputy Medical Officer of Health, Dr. Brent Mallockney, médecin adjoint en santé publique, Stephen Willis, General Manager, Planning, Infrastructure and Economic Development, Directeur général, Service de la planification, de l'infrastructure et du développement économique, Valerie Turner, General Manager, Innovative Client Services, Directrice générale, Service novateur pour la clientèle, and Saïd Saya, Director, Housing Services, Directeur, Service des logements. I will now invite each agency to ask their question. You may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. If for some reason we lose you during the call, please try reconnecting or contact medias@ottawa.ca to submit your question. We will now start with Kate Porter at CBC Ottawa.
Hi there, everybody. Thanks for taking my questions. I'll stick to the Heron Gate file today. Mayor, I was wondering, just given how long this has been going on, the evictions, et cetera, and that some people were rallying outside your office today because they still were not pleased with it. I wonder what message you have for the residents of Heron Gate about what's to come for their area and what's happened today.
Thank you, Kate, for the question. The message I have to the residents and future residents of that part of the city and in the Alta Vista community is that today we secured a deal that has been described as a landmark deal by those involved in the drafting of it that will allow more people to live in more affordable housing in one particular community than we've ever been able to negotiate in the past, 1,020 affordable housing units. Would we like to see more than 1,000? Of course. Would we like to see deeper discounts in the rent? Of course. But as you know, because you've followed this story a long time, the company was not required to do any of what we asked them to do in the social contract. And so I commend our staff, I commend the working group, Councillor Cloutier, for working really, really hard on coming forward with a very solid package of recommendations that not only improves the financial situation of people looking for affordable housing, but also improves the neighborhood with $1 million investment in Sandalwood Park and other amenities to make that a more complete community. Thank you.
En français, s'il vous plaît.
Oui, certainement. Je suis très fier de l'entente avec la compagnie dans le quartier d'Alta Vista et la ville d'Ottawa. Ça va fournir plus de logements abordables, 1020 nouveaux appartements et maisons. Et aussi, à la même temps, on avait une entente pour améliorer les choses comme les parcs, le parc Sandalwood dans cette communauté. Et certainement pour moi, c'est une occasion pour célébrer un succès parce que la compagnie n'avait pas le, comment on dit, didn't have to signer un contrat comme ça. Il avait la permission de construire plus de 5000 résidences sans logement abordable, sans amélioration pour les parcs, etc. Et je dis merci à la communauté, la compagnie, le personnel de notre ville et M. Cloutier, le conseiller pour ce quartier, qui travaille très fort sur ce dossier. Merci.
And my second question for you, Mayor, but I don't know if Steve Willis might want to weigh in. Just given the debate or the discussion here about this being a private developer, not social housing, what does the city think is fair to ask of a private developer when it comes to adding affordable, much needed affordable housing in the city?
Well, I think in an ideal world, we'd have more tools from the provincial government, including inclusive zoning, that would give us the ability to set benchmarks and set goals and make sure those goals are achieved. What we did over the last 4 years with this particular project was, in fact, based on the goodwill of the company. They could have walked away and said, we're not interested in providing any affordable housing. So if we had greater tools from the provincial government, inclusionary zoning being the most obvious one, then I think we could do much more partnership with the private sector. And there's always give and take. You know, we've done, for instance, in the past, you give more density if you provide more affordable housing units. And that was the case in the Bayshore example that Councillor Kavanaugh worked on. And it was the case of this project in the Alta Vista community. Thank you.
Thank you very much. Moving on, we will go to Parushka Gopalkista at City News Ottawa. Parushka, are you there?
Hi, can you hear me?
If you're there, please press your unmute button. Okay, moving on, we will go to Ted Raymond at CTV Ottawa.
Hi there, thanks for taking my questions today. My first question is for Mr. Kanellakos, but the mayor is welcome to weigh in on this as well. It's about the city's mandatory vaccination policy. I know you've said previously that discipline for employees who refuse vaccination could include up to termination, but can you describe what kind of actions the city would take before it came to that?
No, thank you for the question. I mean, we implemented the policy, and you know we have the right to implement a policy to ensure that our workplace is safe, that our employees are safe, and the people we deal with in the community are safe. And our intention is not to go from implementing a policy, encouraging people to who aren't vaccinated to take the educational course, which we'll be posting online in the coming days, next few days, trying to get people to encourage them to be vaccinated. But our objective is not to go from that to dismissal. Obviously, if it's a job requirement to be vaccinated, you won't be able to enter the workforce the workplace after November 1st. So there could be consequences, but we have to deal with each case on a case-by-case basis. We are mostly a unionized workforce. 95% of our employees belong to either a union or an association. And there are steps that we take in terms of discipline before you ultimately lead to dismissal. Could there be dismissals ultimately in cases? Yes, there could be, but that's not our objective. Our objective is to educate, to encourage, to support our employees so that they make the right decision for the health of all of us.
Okay, excuse me 1 second. And my follow-up question, I guess, is just to follow up on that. In terms of if it does come down to dismissal, this is, it's my understanding, kind of a legal gray area at the moment. What do we have in terms of the legal team saying about the possibility of challenges if someone should be dismissed because they haven't been vaccinated, and is the city prepared for that?
Well, the thing is that many employers have taken this position, particularly in the public sector. All our hospitals in the Ottawa area have taken this position, and I think that whether it's the City of Ottawa that gets challenged first or another employer gets challenged first, as I said, most of our employees are unionized. These cases, if they do lead to dismissal or any kind of discipline that the union representatives may wish to take through the grievance process and ultimately to arbitration, those cases will be settled there or ultimately through the courts. And those will then set the benchmark in terms of how all employers will be able to implement or enforce the policy. And so, yes, we are in a gray area legally. That hasn't been tested yet. And but I know for certain it will be challenged at some point, somewhere in Ontario, and we'll be watching that very closely in terms of how it impacts the policy, and then any amendments we may have to do the policy if those challenges are successful.
Thank you very much.
Thank you, Ted. We will go back to Parushka. Parushka, are you there? Okay, if you're there, Perushka, you will have to speak up louder. We can't hear you. Okay, please submit your questions to media relations. Media is at ottawa.ca. We will come back to you. Up next is Craig Lord at Global News.
Hi there. I think this would be for Dr. Malachny. I'm curious if there are any updates on third doses in Ottawa. Do we have any data yet on how many have been administered? And is that going to be added to the vaccination dashboard at any point?
So at this point, third doses are identified by the province in terms of who is eligible. This has been predominantly to date individuals living in long-term care and high-risk retirement homes, some other congregate settings, as well as individuals with specific medical conditions where they're immunocompromised. So that's what has been done so far. I don't have a number off the top of my head, but we can get that to you after this. I guess the bigger question will be, will we see other groups added? There is a science advisory group for the province that's looking at this. So I think it's likely that, as we go further into the fall, that some other groups will be prioritized for third doses, but we'll wait to hear from the province and the National Advisory Committee immunization on that.
Thanks very much. And I just want to touch on, it's been about a week since Quebec's vaccine passport program has been implemented, and you were talking about how you were worried that we might see an uptick in unvaccinated visitors from Gatineau because of that. Has OPH tracked any increase in transmission from the other side of the Ottawa River to date?
Thanks. No, not that we're aware of. I mean, that sort of thing would likely take a while for people for transmission to have occurred, to go for testing, to have someone talk to them. So it's still early. I mean, I think as we indicated last week, we are one region. People move back and forth for work, family, social reasons. But nothing that we've detected so far. I have an answer for your previous question. We are looking at adding a third dose of data to the dashboard. It's something we're working on, and we'll give you a heads up when we're going to be launching that.
Thank you very much.
Thank you, Craig. Nous allons maintenant passer à Julien Paquette à Le Droit.
Bonjour, la question serait pour M. Watson. Bon, je comprends que le vote d'aujourd'hui là-dessus n'a pas passé, mais est-ce que vous seriez ouvert à ce qu'il y ait une discussion un peu plus approfondie sur ce qui est considéré abordable comme logement à Ottawa, ou vous êtes satisfait des paramètres qui sont en place actuellement?
Bien, le logement abordable est un dossier malheureusement très compliqué dans notre pays parce que il y a des trois paliers du gouvernement qui travaillent ensemble. La province et le gouvernement fédéral fournissent des fonds, mais c'est la province qui a adopté des politiques, par exemple inclusive zoning, et dans notre province, les municipalités sont responsables pour la construction de logements abordables. Alors, certainement, je suis un optimiste que les trois partis, le NPD, le libéral et conservateur, et aussi le Parti vert, avaient des politiques pour le logement abordable. Mais c'est important pour nous autres de continuer de convaincre les provinces et le gouvernement fédéral de fournir des fonds parce que cette situation aujourd'hui est une bonne décision. Je suis d'accord avec la décision, mais c'est nécessaire pour nous autres d'offrir plus des rabais, discounts pour logement social comme Ottawa Community Housing et CCOC, etc. Alors, la meilleure situation est de fournir des logements comme le logement de communauté à Ottawa Mais pour le moment, cette entente avec le projet dans la communauté d'Alta Vista, c'est un bon compromis parce qu'il va fournir presque 1020 nouveaux appartements abordables.
OK. Puis, concernant la possibilité d'avoir des nouvelles règles de zonage de la part de la province pour justement forcer l'inclusion de logements abordables, est-ce que vous avez eu des discussions avec la province là-dessus? Sentez-vous qu'il y a une possibilité que ce soit quelque chose qui vienne dans un avenir approché?
Bien, certainement. On a commencé avec le projet à Bayshore avec 8% des appartements abordables. Et maintenant, cet nouveau projet à Alta Vista, c'est 20% abordables. Et j'espère que dans l'avenir, nous sommes capables de travailler avec les autres compagnies privées pour signer une entente similaire que l'entente qu'on a signée aujourd'hui. Mais c'est nécessaire d'avoir les deux parties, la ville et le secteur privé, de travailler ensemble. Et certainement, notre personnel sait que ça, c'est une bonne façon de fournir plus des appartements abordables. Ce n'est pas parfait, mais j'espère qu'on va signer des autres ententes comme ça dans les prochaines années. Et si la province a donné le pouvoir pour le zonage inclusif, ça va aider la situation beaucoup. Merci.
Merci beaucoup. Veuillez noter qu'en raison de problèmes techniques, il n'y aurait pas d'interprétation en français aujourd'hui. Please note that due to technical issues, there will not be any French interpretation today. Up next, we have John Willing at the Ottawa Citizen.
Hey, Kina, thank you. It's a question for Mr. Willis. I can predict an urge by communities and councillors to pursue MOUs and development applications for things like social housing, maybe for other matters like infrastructure upgrades. I'm wondering if you see a permanent place for these type of agreements and land use planning at City Hall, and do staff even have time to handle these? And do you think, and this is kind of a triple barrel question, but will an inclusionary zoning policy wipe out the need to come up with individual MOUs?
So these are early days, John, and Ottawa's, like every other city in Ontario, is struggling with exactly the same problem. So I'm comparing notes with my colleagues in other cities about how we're handling this. We have today what's called Section 37, which is a bonusing provision, which gives us powers. And a lot of what we did today was enabled by Section 37 plus the MOU together. The province is taking that away. So by the end of next year, we won't have that legal power. So MOUs will become our main tool. We'll have a new community benefits bylaw, which is really more of a charge, like a soft development charge for soft services, but it won't, you couldn't use it to get units in a building like we did today. So I think there will be still situations like this where we're trying to get into these voluntary agreements. And that's why we work very closely with community social services. Mr. Saya is on the line. He and I work very closely with our teams to try to advance these discussions with developers. And I think in large applications, it's something we just have to try to do our best on. So it's a priority. Council has said over and over again, this is important. Inclusionary zoning will give us a legal tool to use around transit stations only. That's where the province has limited its application, and it will be very helpful when we bring it into place. But it's complicated discussion with the development community because they're concerned that it's passing off the costs to other forms of housing and that will affect overall housing affordability. So council will have to make some decisions on that when we get to that point.
Thanks, Mr. Willis. My next question is regarding the mandatory vaccination policy for Mr. Kanellakis. And just jumping off Ted's questions, Steve, I'm wondering at what point would a city employee lose their job if they're not vaccinated? Do you have a number of months in mind? And the second part of that question, has the city to this point received any grievances or other legal action regarding the new vaccination policy?
No, thank you, John. I'll start with the second question. There's been no grievances at this stage from any of our unions or associations. And as I said to Ted, the progression of discipline is a principle, right? It doesn't go from necessarily from you're not vaccinated to you're fired. We work with the employee, we review it on a case-by-case basis to see what disciplinary steps might be taken. But it's clear that if you're not vaccinated, you can't report to the workplace. So you're in a situation where you're either going to be on some kind of leave or unpaid leave, or other disciplinary action may happen before dismissal. So that process, in terms of, to answer specifically how long would it take, is uncertain, because obviously most of our employees, 95% in fact, have the ability to grieve, and that process takes time, and then it goes to arbitration. So unionized employees just aren't normally fired on the spot without some kind of a step process, working with the unions and through the process that's in our collective agreements to bring resolution to discipline. And so, we don't want to get there. As I said, we're going to be doing pop-up clinics in our workplaces to encourage people to be vaccinated. We're doing the education sessions. We're going to be supporting our employees from now to November 1st to encourage them to get vaccinated. But it's clear, after November 1st, if you're not vaccinated, you can't step into the workplace as an unvaccinated person.
Thanks, Steve.
Thank you very much. We have a question from Perushka at City News. Her question is, what would you say is the main concern for residents who are still worried about the affordability aspect of the units?
Well, I can comment on that. As indicated, I think I mentioned this in French, we don't have a lot of tools in our toolkit that would ensure that the private sector has to provide a certain number of affordable housing units. What we were able to do was build on the success of a first agreement of its kind in the Bayshore community, where 8% of the units were designated affordable. And the deal that was signed today or approved overwhelmingly by council today brings that number up to 20% of the units that will be considered affordable in the Alta Vista case, where Councillor Cloutier and others worked very hard to get to that number, as well as other incentives, including $1 million to improve the local park for kids and families. So, we would, as you may know, I sent out a survey for all of the political candidates running in the 9 Ottawa ridings. And the very first question, I believe, was on affordable housing, because it continues to be a priority of mine personally and of our council. And we obviously need to see more affordable housing with deep rent reductions as soon as possible. And we're very glad that housing has become a key part of the federal election campaign, where all the party leaders of the major parties are discussing ways to improve affordability for people who want to buy a home, for people who want to find an affordable apartment or townhouse. And that's a good first step. Thank you. Merci.
Thank you very much. We will now be going to Jackie Miller at the Ottawa Sun.
Hi there, thank you. I was wondering, with kids going back to school, I had a question about the daily COVID symptom screening quiz for public health. A couple weeks ago, Dr. Etches said that kids that had a runny nose or a headache really should stay home and get tested for COVID. But the screening quiz that is being used by OPH doesn't include either symptom as suggestion for testing. I'm just wondering what changed, especially given that we've been told to expect a surge of COVID cases this fall.
Yeah, thanks for that. I'll take that question. So the province has released the school and childcare screening tool. It has changed from last year in that children with minor symptoms, so as you said, a runny nose, also in that group would be a sore throat or a headache, do not need testing, but they do need to stay home. And OPH has developed our version of the provincial screening tool, and it clearly identifies that if a child has a minor symptom, that that they should stay home, because general principles, we don't want sick children in schools. Well, we want schools to stay open, but children who are sick need to stay home. This fall, we're likely to have more respiratory viruses than were in play last year. So just said, so children with a minor symptom like a runny nose, sore throat, do not need to be tested, but they do need to stay home until they've been feeling better for at least 24 hours. Certainly, one of the things that was observed last year was the importance of screening. The more COVID that is in our community, the more opportunities there are for importation of cases into schools. Most cases we saw last year were due to importation, and as community rates went up, then the number of cases we saw in schools went up in parallel. So that's important for all of us to keep the rates of transmission low, to make sure children are screened every day, and that if they're ill, that they don't go to school. Certainly, if they have a fever or a cough or any of the other symptoms identified in the screening tool, then they should be tested. But otherwise, with minor symptoms, to stay home until they're feeling better for at least 24 hours. Certainly, if a child has a minor symptom and the parent is concerned they may have been exposed to COVID in the community, then certainly they are welcome to have that child tested and stay isolated until the results back.
Thank you. Can I get a follow-up?
Yes, go ahead, Jackie.
Thanks. This is also regarding schools. The 4 boards in Ottawa have all adopted slightly different public health measures that go beyond the provincial guidelines. I was wondering if you could clarify what Ottawa Public Health has recommended for the school boards. Were the boards all given the same recommendations, or were they all given different recommendations on some specific areas, such as masks for kindergartners, whether the kids have to stick with their classmates at recess, whether they should eat lunch in their classroom, wear masks when they're doing indoor sports, and whether extracurricular activities should be allowed and when?
There's a lot to that question. So let me see. So first off, when we were looking at the provincial guidance for school reopening, we worked with our colleagues in other public health units across Ontario and actively discussed what we thought were important additional public health measures to have in place for school reopening. We think it's important to be cautious at the beginning of the year, see how it goes, and if things are going well and we're not seeing very many cases or transmission, then to be able to reduce the amount of measures in place. So we worked with our colleagues. I mean, as you know, there's 34 public health units across Ontario, and we didn't want to end up with a checkerboard of policies. And so we reached consensus on what we thought were the most important recommendations or areas of recommendations. And we shared those with our 4 local school boards and had a discussion with them. And I mean, it's ultimately up to them, considering their context and implementation issues, as to how best to implement them or whether to fully implement them. So they all were shared the same set of recommendations to all 4, but it is the discretion of the school board as to how best to implement. Certainly, for example, with masking in kindergarten, that was an item that we recommended. We certainly also thought that that cohorting is important. So again, this is a little bit in terms of how individual school boards can think this through and implement it in their schools. But one of the principles in controlling or reducing risk of transmission in schools is to have these layers of protection. So we've got screening up front, and then we've got masking and cohorting and distancing. And so in our recommendations, for example, for recess and break time, to try and have children stay in their cohorts as much as possible, so that if by chance a child is positive in the school, that it limits the number of children that could possibly be exposed versus if there's lots and lots of mixing. So it was just the general principle of cohorting, and so then we left it up to the school boards as to how best to implement. With respect to sports, certainly we had seen a fair bit of transmission among sports teams last year, and so we thought for the start of school, particularly for indoor sports, particularly concerned about sports where there was a lot of contact or inability to maintain distancing, particularly in an indoor situation, and therefore recommended masking in that situation. Again, to be cautious with the start of school, to limit the risk of transmission in schools with the principle of keeping schools open this year, and we'll closely observe what happens over the next month or two in terms of the need to tweak or adjust our recommendations to the school boards.
Thank you.
Thank you very much. Nous allons maintenant passer à Antoine Trépanier à Radio-Canada.
Bonjour, Monsieur le maire. Je veux parler d'armes à feu, de fusillade. Il y a eu une autre fusillade, on parle d'une 50aine cette année. Je crois que vous rencontrez le chef Slowly cet après-midi. Quand vous regardez les données qu'on a dans la capitale, qu'est-ce que ça vous dit et qu'est-ce que vous voulez de votre chef de police en ce moment? Peut-être ce que vous pensez de tout ça en ce moment.
Oui. Mais certainement, Antoine, c'est une situation sérieuse. On a vu beaucoup des fusillades, non seulement dans le centre-ville ou le marché Bay, mais à Canada, Alta Vista, Nepean. Et ça, c'est la raison que dans une demi-heure, j'ai une réunion avec le chef de police et des autres personnes comme M. Kanalakis pour discuter la situation et pour poser la question à M. Slowly, qu'est-ce que le service de police va faire pour améliorer la situation? Est-ce qu'il avait des suggestions pour contrôler ou éliminer des fusillades dans la ville d'Ottawa? La ville est encore une ville très sécure, mais certainement un acte de violence est trop, à mon avis. Et ça, c'est la raison que j'ai parlé avec M. Slowly pour établir un dialogue cet après-midi. Et on va travailler aussi avec les résidents de la ville, les personnes qui avaient des restaurants et des clubs et des choses dans le marché Bay, parce que ce n'est pas acceptable de voir des fusillades comme on a vu pendant les derniers 2-3 mois.
Follow-up particulièrement là-dessus, parce qu'on a vu au Québec hier les maires des 5 plus grandes villes québécoises, notamment votre voisin Maxime Petneau-Jobin, se joindre pour demander aux partis fédéraux de mieux réglementer notamment le trafic d'armes, mais aussi les armes de poing. Je sais que ça fait partie des priorités que vous avez envoyées aux candidats locaux, mais est-ce que vous voulez faire un pas de plus? On est le jour 1 là, du débat des chefs là, ce soir. Est-ce que vous faites une demande particulière aux chefs fédéraux par rapport aux armes de poing, par rapport à la violence qu'on retrouve notamment à Ottawa?
Oui, comme tu sais, on a envoyé un sondage, un questionnaire à tous les candidats locaux pour les partis ici à Ottawa parce qu'on avait 9 circonscriptions. Et on a posé la question au sujet des guns and gangs, les fonds pour aider les polices municipales. Et j'espère qu'on va recevoir des idées spécifiques et des promesses de finances pour aider avec les groupes comme Guns and Gangs pour aider les résidents de la ville d'Ottawa. Alors, pour moi, c'est important de contacter les candidats locaux et, comme j'ai dit, j'ai posé une des 8 ou 9 questions au sujet de sécurité dans notre capitale ici. Merci.
Merci.
Merci beaucoup à tous. Thank you, everyone. This concludes our media availability today. Ceci conclut notre point de presse pour aujourd'hui. Have a great day. Bonne journée.